Hello everybody, Dr. Paul Yerkes from Core Family Practice. I wanted to release another video regarding a hot topic that's kind of been all over the news recently with the new illness that's sprung up, this time concerning vaping. So vaping, just given a little history, it's the most common form of smoking among teenagers. It has been marketed heavily towards youth, adolescent, and teenagers through social media and with crazy flavors. It has led to the most largest ever recorded increase in substance abuse in the past 43 years for any adolescent substance used, which is insane. And this is probably because of the nicotine content that's in the vape pods. The way it works is it heats up the nicotine liquid into a vapor that is then inhaled by the user. And one pod contains the same nicotine content of 20 to 40 cigarettes. And what nicotine does, it activates the reward center of the brain. It gives you the sense of euphoria. It can reduce stress in some individuals, but still has the addictive quality that nicotine does in cigarettes or other forms of tobacco. So a lot of people will say, well, but it's better than smoking. And while this may be true, as there tends to be less chemicals in there are still a significant amount of chemicals that we don't know what their health effects do have. And these include polycyclic aromatic hydrocarbons, volatile organic compounds, toxic metals. So there's still other stuff than just the simple nicotine, which again is being inhaled at a very high dose. So the big thing that you probably heard is vaping-related lung injury. And what we've seen is over 1,200 cases have occurred since I think it started tracking around August timeframe. We saw 250 cases across the country just last week. About half of those required hospitalization, and another third of those required intubation. And that's where we have to stick a tube down the throat to help you breathe, and you're connected to a machine at that point. We've had over 20 deaths, with some occurring as close as New Jersey. And 1/3 of the patients seem to be less than the age of 21. Now, as in most diseases, being a little older tends to get a more severe version of the disease and tends to have more difficulty recovering. But still, 1/3 of patients being under 21 really shows you how common these devices are within that age group. Now, the symptoms that we're seeing with this often is chest pain, cough, shortness of breath, very similar to having a pneumonia. When we do a CT scan of the chest or imaging of the chest, what doctors are seeing is that it's like a chemical-like burn to the lungs. We're actually seeing the structure in the lungs actually being damaged by the vaping liquid. And it happens pretty quickly, and this is what scares me personally. So in one instance, a Chicago teen was driving to college out in Colorado. She was driving with her mom, and as they crossed into Nebraska, she started having a little chest pain and a little bit cough. They didn't even make it out of the state before they had to rush her to the hospital, and they found that she had a complete whiteout of her lungs, and she was admitted there for about 3 to 4 days. Afterwards, she admitted to only vaping 2 to 3 times a week. So it's something that can happen very quickly and not with much perceived use. Overall, we have not pinpointed the specific cause. We do know 80% of those people who come down with this disease and illness tend to have smoked THC as well as nicotine pods, but there's still about a 20% 20% of patients have only used the nicotine pods themselves. So as you can see, we can't point it to any specific substance in general, and we're trying to play catch up as to the cause and the risk overall that's presented by these devices. So ultimately what the CDC and the medical community is saying is that please avoid vaping until more knowledge is known, and particularly avoid any THC or adding any other substances to the vaping products at the very least. This is something that's very scary and not worth the risk at this time. If you have any questions, leave them down in the comments section and let us know, and we can discuss a little further. Thank you.